Hello students and viewers, welcome back to my session. And if you are tuning in for the first time, let me introduce myself. I'm Veronica Nriame, working as a psychiatric social worker in District Mental Health Program, Naga Hospital, Kohima. Before I begin with my topic, I thank the Department of School Education for giving us this platform. Today, I will discuss on suicide and its prevention. I'm sure majority of you have heard about suicide and are familiarized with the term. You must have heard it from your friends, movies, or you have seen it from social media, or you yourself have experienced suicidal tendency at some point in your lives. So let's begin with the topic. Suicide is derived from the Latin word self-murder. So suicide is the termination of one's life intentionally. When we hear the word suicide, it indicates negative aspects, and we are called, and those who have suicidal tendencies or have attempted suicide are looked at differently and are given different names, which is called being weak or passive, deranged, and so on. But we must know the truth here, where suicide is the second leading cause of death among 15 to 29-year-olds according to World Health Organization. Every suicide is a tragedy, and it is estimated that 800,000 people die by suicide every year. And this tragedy of suicide, it has a huge impact on the families, friends, and communities. Suicide prevention is a very important topic among children and adolescents, so it should be given a high priority. And the fact that most of this age group attend schools or colleges, this appears to be an excellent platform to discuss about suicide prevention and spread awareness. When it comes to suicide or any mental health or any mental illnesses, there is always a stigma attached to it. So let's clarify or dispel some myths about suicide. People who talk about suicide do not mean to do it. That is the first myth which we will discuss. And the fact is, people who talk about suicide may be reaching out for help or support. A significant number of people contemplating on suicide is experiencing anxiety, depression, hopelessness, and feel that there is no other option for them. Whenever they encounter any crisis or emotional distress, because of the stigma or because of the misconception against suicide, they felt that there is no one who can understand or listen to them. Another myth is most suicides happen suddenly without warning. And the truth is, or the fact is, the majority of suicides have been preceded by warning signs, whether it be verbal or behavioral, which we will discuss about the warning signs in the coming slides. Another myth is someone who is suicidal is determined to die. On the contrary, suicidal people are often ambivalent about living or dying. Some may act impulsively by drinking pesticides or by taking overdose of medicines, even though they would like to live on. So access to emotional support at the right time can prevent suicide. Talking about suicide is a bad idea and can be interpreted as encouragement. That is another myth. And the fact is, given the widespread stigma about suicide, most people are contemplating suicide because they don't have anyone to express their thoughts or their unhappiness or whatever consequences they are going through. So rather than encouraging suicidal behavior, which is stated in the myths, talking openly can give an individual other options or given them the time to rethink his or her decision, thereby preventing suicide. Another myth is only people with mental disorders are suicidal. And the fact is, suicidal behavior indicate deep unhappiness, but not necessarily mental disorder. So many people living with mental disorders are not affected by suicidal behaviors, and not all people who take their lives have mental disorder. That is the fact. Another myth is once someone is suicidal, he or she will always remain suicidal. That is another myth. And the fact is, heightened suicide risk is often short-term and situation-specific. While suicidal thoughts may return, they are not permanent, and an individual with previously suicidal thoughts and attempts can go on living a long life. An individual who has attempted suicide in the past will not do it again. That is also another myth. The fact is, it is true that everyone may not have repeated attempts of suicide. However, a sizable proportion of people who commit suicide have history of previous attempts of suicide. So previous attempts of suicide is a risk factor, not a protective factor against suicide. So these are the myths which we should clarify so that we can reach out and we can prevent the suicide or anyone who is experiencing suicidal tendencies. Now let's discuss about the warning signs of suicidal behavior. In order to prevent suicide, we need to know what are the warning signs so that we can help out that particular person. So here are few signs talking about suicide. For example, your friend might come and say to you, I have nothing left to live. I won't be a burden to my family anymore. Or they might directly say to you, I should just kill myself. Or someone might state a statement of hopelessness, I'm not pretty like others, I'm not successful like others, I'm not bright like others. That kind of statement of hopelessness, helplessness, wordlessness, these are the warning signs of suicidal behavior or who is contemplating on committing suicide. And loss of interest in things one cares about. And another warning sign is unusual visiting or calling people one cares about, saying goodbyes. And another warning sign is making arrangement. They try to set one's affair in order. For example, if they have any arguments with anyone or there is some disagreements between him and his friends or with her friends, they try to set things right with their enemies. And another indicator is giving things away. Before they contemplate or before they attempt suicide, they give away things which is very dear to them or which is of their extreme likings. And last warning signs which we will discuss is preparation. Preparing for death, such as arranging means, for example, storing pills or rope, kerosene, pesticides. These are the warning signs which we should watch out so that we can prevent someone from committing suicide. Now let's discuss about the risk factors. So amongst the adolescents, we can see into the personality traits which are vulnerable in committing suicide or in completing suicide. First is cognitive style and personality, such as unstable mood, angry or aggressive behavior, antisocial behavior, acting out behavior, high impulsivity, irritability, and poor problem-solving ability when difficulties or problems arises. This is one risk factor. Another is any recent significant stress. Might be separation from friends, girlfriends, boyfriends, or death of a loved one, or any other significant person, or termination of love relationship, or if there is a history of bullying taking place in that person's life, or if the student is disappointed with school results and failures in studies. Or another risk factors can be unemployment. Another risk factor is poor social support. If the person fails to maintain a healthy relationship with their friends, with their family members, that can be a risk factor. And amongst the adolescent eating disorders, mostly of anorexia and bulimia, where profound disturbance of body image and pursuit of being thin and slim, where they give utmost importance to their physical figure. And another important risk factors is presence of depression. So the combination of depressive symptoms and antisocial behavior, that is of a risky factors. So a few important signs of depression, which is persistent low mood, feelings of worthlessness, loss of interest in activities which enjoyed in the past, ideas or acts of self-harm, or pessimistic attitude towards future. That is another risk factor. And risk factors on the individual basis is previous suicide attempt, which I have mentioned earlier. That is another risk factor. And family history of suicide, like I have mentioned earlier. History of suicide or any family committing suicide has a huge impact on the family members or near and dear ones. So that is another risk factor. Or again, another risk factor is harmful use of alcohol and other substances. If there is history of alcohol and other substances, that can increase the risk of suicide. We have few patients in our OPD who came after committing suicide that happens under the intoxication of alcohol. And other risky factors can be barriers to access healthcare because of the stigma, and or if the person have chronic pain and illnesses. That can be the risk factors, or that can make the person vulnerable to commit suicide. So these are the risky factors which makes the particular individual vulnerable to commit suicide. Now let's discuss about the protective factors. Here, the most important aspect of any suicide prevention is recognition of children and adolescents or any individuals who are in distress or at risk of suicide. So, since majority of my audience are adolescents or schoolgoers, the first protective factor is strengthening the mental health of school teachers and other staff. First of all, it is very essential for teachers to have secure well-being of physical and mental health, and they should have good understanding about what are the mental health problems, signs and symptoms, so that they can reach out to their students and prevent the suicide or any suicidal tendencies. And the next important point, which is a protective factor, is strengthening students' self-esteem. Positive self-esteem protects children and adolescents against any mental distress. And this positive self-esteem will enable them to cope adequately with difficulties and stressful life situations. So enhancing the self-esteem of students is very important so that it can prevent them from any negative thoughts or any suicidal thoughts. Again, promoting emotional expression. Creating a platform for the students to express what they are going through, or if they're going through emotional crisis, if there is a platform to express that, or if there is no stigma where children can or students can freely speak out their mind, that can prevent suicide. And another important protective factor is preventing bullying and violence at school. So here, it is important that every school should have anti-bullying policy to prevent bullying and violence in and around the school premises. And this will create a safe environment free of intolerance. Again, another important protective factor is communication, where there is a free flow communication between the students and the teachers. And another important protective factor which we should consider is referral to mental health professionals. A prompt, authoritative, and decisive intervention. So if you see anyone in distress, or if anyone is going through crisis, or you have noticed some behavioral changes, always make sure to refer them to mental health professionals. And another protective factor is reducing stigma. Let's try to reduce stigma so that we can prevent anyone who is contemplating on committing suicide. And another protective factor is positive life skills and availability of facility for mental health care. So these are the protective factors which will prevent an individual from committing suicide. Now let's briefly see how to identify students in distress and at possible risks of suicide. So these are the identification of distress. So any sudden or dramatic change affecting a child's or adolescent's performance, attendance, or behavior should be taken seriously, such as lack of interest in usual activities, there is an overall decline in grades, decrease in effort, or misconduct in the classroom, unexplained or repeated absence or truancy, or there is excessive usage of alcohol, drugs, or any other substances. These are the signs which teachers and parents should look out so that we can prevent. So to wind up, let us try to create a supportive environment to prevent suicide. Because every single life lost to suicide is too many. So the way forward here is to act together, and the time to act is now. So I call upon all the viewers and listeners to make suicide prevention as our motto, and let's try to create a supportive environment where we create a platform for those individuals or for those students or for anyone who is struggling to cope with the life challenges alone. So let's try to create a supportive environment for them to open up and share whatever struggles they are going through. And again, I would like to speak out to those experiencing suicidal tendencies or going through personal hardships. Always remember that there is always help if you are finding difficulty to face your issues or problem alone. Always reach out for help, and you can reach out to any mental health professionals because suicide is preventable. Thank you so much for tuning in.